Hi, I'm Dr. Hung Vuong. In this video, we'll be talking about sciatica, specifically herniated disc that cause sciatic pain. Another common condition that causes sciatica is known as piriformis syndrome. We have a video about this, so if you are interested, please check out the link in the description below. This is a model of your spine, and I want to show you in close-up what a herniated disc looks like. So you see here, this red object right here represents a herniated disc. These are your discs, spinal disc. And in between, behind the disc here, you see these yellow object here. These are representing your spinal nerves. So basically, they come out, all these nerves comes out from the back of the spine and come together to form the sciatic nerve. So if any of these levels here has a herniated disc, it can actually pinch the nerves that are coming out from the back. So in this case, you see this red object here is actually putting pressure on this nerve that's back here. As a result, it will send pain down to your legs, also numbness, tingling, weakness, and sometimes patients complain of stiffness, especially in the morning when they first wake up. So when patients present to our office with this condition, the first thing we have to check is the spinal, for any spinal misalignment, because when your spine is basically taking all the weight of your whole body. If there's a spinal misalignment, what happens is that some of the weight distribution is not correct, and one side of the body is taking more pressure versus on the other side. So over time, what happens is it actually weakens the disc, the side that's taking more of the pressure of the weight of the body. As a result, the disc will start bulging backward, and over time it can lead to a herniated disc and cause sciatic pain. Now after we check for spinal misalignment and correct them, the next thing we will do is we will do some traction. So what traction does is it actually opens up the disc space here because you have a compressed disc. As a result, it causes the herniation. So when you open this joint space up here, theoretically the disc has a potential, it has a chance to actually go back inside. So after we do traction, we also have patient do some exercise, some stretches at home. So let's get right to it. So the first thing that we are going to do is called nerve flossing. So assuming my left leg is the leg that's in pain, what we want to do is we want to bring this leg up, and as this leg goes up, we will look back gently. Okay? And then as we look down, we want to bring our leg back down. And then you repeat this again, swing this leg up and look up. And as you look down, you bring this leg back. So you want to do this for about 10 times, sets of 3. You might feel a little bit uncomfortable, a little bit discomfort while you do this, but it's okay as long as it's not too severe. Okay, this next one, what we want is we want both feet up against the wall, and then we'll sit up straight, and then again we are doing another nerve flossing. So we want both hands behind your neck, and then pull gently down. And as you do this, you will sometimes feel some irritation to the leg that's in pain, but it's okay if you have slight discomfort. Again, you hold it for about 10 seconds. Go back up slowly. You can relax for a few seconds and then repeat the process. You want to do this about 4 times. Okay, for this next exercise, what we want is we want to push our core, okay, your lower back into the floor. So basically, it's like you trying to push your belly button into the floor. Okay, so go up, relax, push it into the floor. Now this is called pelvic tilt, and you want to do this again for about 10 times, and you want to do this in sets of 4. So it's very gentle. Okay, and then after you do that, the next exercise we'll be doing is called bridging. So again, same position, but this time you want to lift your back up. And as you lift it up, hold it for maybe about 3 seconds, and then slowly go back down. And then repeat, up, hold it for about 3 seconds, and relax. Up, hold it for about 3 seconds, and then slowly lower it down. You don't have to push yourself all the way up. I don't want you to do that. So you just want to get it somewhat in a straight line, and then you can go ahead and relax from there. Again, you will do 10 of these in sets of 4 again. The next one that we will be doing is called just basically some low back stretch. So you want to bring your left leg up, use both hands, put behind your knee, and then pull. You want to pull this up to your chest and then hold it for about 10 seconds. After 10 seconds, go ahead and relax it. And then you do the same thing for the opposite leg. Again, hold it for about 10 seconds. After 10 seconds, you go ahead and relax that. And then what we want is we want to bring both legs up and then pull and then hold it for 10 seconds. After 10 seconds, you can go ahead and relax. Now once you do this side, and then both legs, we consider that as one set. You want to do 4 sets of these. Again, now some of us might struggle and we cannot reach this far, so what you can do is grab a towel or a belt and put it behind your knees, and you can use that and pull toward your chest, making sure your opposite leg is completely flat on the floor. So this will work too. Okay, so those are the stretches and the exercise that we do for patients who have sciatica due to herniated disc. And I just want to keep in mind that sitting and laying down prolonged period of time can actually irritate the condition and make it worse. Moving around, walking is definitely a very good exercise for sciatica as well. Just if you can't do it long, then try starting 5 minutes. After you can do as things gets better, you can do 10 minutes, 15, 20 minutes, so on and so forth. Just make sure you walk on a flat surface, not something that's bumpy ups and down. So a treadmill is a perfect example, or sidewalk within the neighborhood is also a good one too. So hope everything goes well, and take care. We'll see you in the next video.